afternoon. Is everybody ready to talk about Medicaid? Very exciting, right? I am Elizabeth Baskett. I work at the Medicaid Department, Healthcare Policy and Financing, and I work on program innovations. And my whole world revolves around the Accountable Care Collaborative, which I'm going to talk to you about. But I first want to say thank you for having me. I have been in Colorado for about 2.5 years now, and I have been so impressed with the passion and the talent that is in this state that is working on our healthcare delivery system. And behavioral health integration and public health integration have been things I've worked on since I've got here, and I've been so excited to have all of you as partners. I love the College of Public Health. We have many people that work at HCPF that are graduates from your school, and many people on my team. And I've also been impressed of the role that you all play in policy making. We're working with Tim on a very important program in Medicaid to deal with behavioral health, public health, and workforce issues. We've worked with you all on SIM and Ben's team. And so I hope we continue to do that, and I want to do that more. So I'm going to talk about a lot of things we're doing, and I'm going to move fast because I've got 10 minutes. But please contact me if you want to be more involved in any of these efforts, because we need you at the table to help us do this right. So who's heard of the Accountable Care Collaborative? Yay! Okay, so this is our primary Medicaid delivery system in Colorado. We've got over 900,000 clients. The majority of our clients are in it now. And we're nationally recognized. Colorado we feel like we're far away from where we need to be, and we're all working really, really hard, but we're actually ahead of a lot of the other states, and that's exciting. And the Accountable Care Collaborative is a great example. So that purple home is what we're trying to create for our clients, a patient-centered medical home, and we just started with that. In 2011, we started this program, and that has been our focus. There's care coordination that comes with this program to tie our clients to the other services in their community. We focused on the medical services. I'm going to talk about our movement more towards other services that are so very important to make our clients healthy. There's also a nice data and analytics component to the Accountable Care Collaborative that really empowers physicians and providers of all type to help their clients by looking at the data and understanding their utilization and their needs. So I crammed as much as I could in this slide, and there's so many other things that I thought of later, and I'm not going to, we could do a whole presentation on many of these things, but I'm going to talk fast and follow up with me if you have questions. Integration is iterative, and it's baby steps, what feels like baby steps, but they can be really powerful steps. So one thing that we did in the last year is say, you know what, if you have high behavioral health needs and you feel comfortable in your community mental health center, that should be your health home. We shouldn't make you go to the primary care office to be your medical home. So we're working on that, and we're evolving our medical home model to allow community mental health centers to be medical homes. We also have new key performance indicators. We're paying now to our partners in the Accountable Care Collaborative based on whether or not they're getting those postpartum follow-up appointments for our new mothers, and whether or not well child visits are happening, so we can do more prevention, more behavioral health treatment in the program. We also have stepped up our game. Our providers now, our medical homes, are being paid more if they meet advanced medical home factors. And some of those are behavioral health related. If you have on-site behavioral health integration, if you do behavioral health screenings and then connect the client with the services they need, you get more money, a per member per month payment bump for being part of our system and integrating behavioral health. So that's very exciting. We're also partnering with CDPHE and Liz's team, and have done a lot of exciting work in the last year. Breaking down the silos between state government, and how do we work together to leverage all of the great work that public health is doing. So specifically, we've focused on diabetes self-management and tobacco cessation. We're also looking at lay workers and how do we use more non-traditional workers to create that health team that Václav was talking about earlier. So I'm really excited about that work. Local public health agencies, we'd like to tie you guys in better with our Accountable Care Collaborative, and we're seeing some really exciting partnerships between our Accountable Care Collaborative partners. We call them RICOs. I won't go into depth on that, but they're partnering with local public health agencies to make sure that clients are getting that preventive health. So we're really shifting to a preventive health model rather than a reactive, let's deliver medical care. Let's figure out how to avoid those chronic conditions before they happen, and LPHAs are a critical partner in that. And then, of course, there's SIM alignment. It's nice to see alignment and great, exciting new efforts and the partnerships that are happening. And we are very engaged in SIM, and we are delivering new payments and new support to our primary care medical providers, our medical homes that are part of the SIM effort. We're also looking forward to partnering more on the population health side of SIM. So, wow, that's a lot. That's a little bit of what we did in the last year. We also have a new payment reform program where we're paying a global capitated payment in 6 counties for behavioral and physical health, and also some access to social services. So that's a new program that we're testing out that's going well. I wanted to briefly talk about the Opportunity Project. Has anybody heard of the Colorado Opportunity Project? A few of you? Okay, well, if you run into our director, that's all you'll hear about. It's a big deal in my world, and this represents a fundamental shift that our Medicaid department is doing to really move towards understanding the needs of our clients, meeting them where they're at in the community, breaking down the silos between the different government agencies, and trying to deliver a package of services to our clients, whether it's physical health, behavioral health, public health, education, job training. What can we do to deliver the right package of services at each life stage to our clients to help them improve their life chances, to help them actually with economic opportunity, to combine our services, deliver them in one package to our clients so that they can reach middle class by middle age, which is actually the goal of this project. So way outside of the normal bounds of Medicaid, we are thinking about how do we help our clients move up and off of government programs where that's appropriate and makes sense. So I won't go into too much more depth on this. It's a very exciting project. We're the first state to try and do something like this, and it really is about aligning all of the different government agencies. We've got indicators at each life stage that we want our clients to try and meet. Being born at a healthy birth weight, to a mother that's not depressed, in early childhood, being healthy in a social and emotional way so that you can learn, continuing to be healthy emotionally as you go through your school and help you graduate from high school, get that job, get to middle class. And how do we do that together as a state? We're using evidence-based programming. The other key part of this is evidence-based programs that are proven, and programs that we know work. We're bolstering the research to show that they do. So that's a jumbled explanation of Opportunity Project because it is a very complex project, but exciting and gaining momentum. We're implementing it now in 6 communities in the state. So then there's the evolution of the ACC. Opportunity Project is part of the evolution of the ACC, but you can see we started with the Purple House, the medical home. And we are trying to move towards health teams now. And that health team has your behavioral health practitioner. It has, like Botzla was saying earlier, your public health provider. It has who the client needs. Sometimes it may have a lay health worker that helps connect clients with the social services that they need. One thing that we've realized through the ACC is that clients need to resolve their social services needs before they can think about their health care. So we're trying to think about the whole person and delivering integrated behavioral health, public health, social services to our clients. So that's represented there also with the LTSS non-medical. We have a dental benefit now for adults we're very excited about, and so we're integrating that into the model. And then you see public health, and really working within the community to leverage the existing programs and tie them in and make sure our clients are getting connected to them. So a big part of our evolution of the ACC is our reprocurement. So the Accountable Care Collaborative, the contracts expire in 2016, and we're taking this opportunity to enhance the program, to evolve it along this pathway that you see so we can make it a more holistic model. There's a lot of opportunity here, and we have a team working very, very hard at looking at our opportunities to leverage SIM some of the flexibility that came out of the Affordable Care Act. How do we pay differently? There will be opportunities for that. How do we improve our systems? How do we integrate behavioral health and public health? That's a huge emphasis of the next round of the ACC. And then client engagement is just huge. It keeps me up at night. Why are we doing all this if we don't have our clients engaged and at the table? And I think there's a huge role in the community, in public health, and in behavioral health to help us engage our clients and engage them in their own health care. So there's stakeholder work going on right now, so I encourage you to go to our reprocurement website on the HCPF webpage, or you can contact me and I'll send it to you. We have a slew of public meetings that are happening. A couple of them we hope will happen at CDPHE and their lovely facilities, where we're getting input from the community. What does it mean to integrate public health in the Accountable Care Collaborative? We've been meeting with CDPHE. We'd like to hear from the rest of the community on how we do that. So look for those public meetings. Please attend. The draft RFP will be released in March of next year. We're releasing the whole RFP for comment, so I hope you'll take that opportunity. New contracts start in July of 2017, and that's a wrap, folks. So thank you.